Hey guys, welcome to our next installment of Whiteboard Talks. Today we're going to conquer one of the most confusing diagnoses that we see in our office, and that's arthritis. If you've been diagnosed with arthritis in the past, odds are you were sent home without very many answers on how to treat that annoying ache that you wake up with every single morning. I'm Dr. Jesse Cease, and as a chiropractor, arthritis is a condition that I deal with on a daily basis. Just about everybody over the age of 40 has some degree of osteoarthritis in their body, and it tends to hit the areas that you've beaten up the most over the years. We believe that education is how you gain power over just about every condition that poses a threat to your health. And today, we're going to educate you on what exactly arthritis is, how it starts, and what you could do to stop it from getting worse. All right, guys, let's get started. All right, guys, let's dive right in and figure out what exactly arthritis even means. So what are we dealing with? That's very important to understand. And a lot of times in the medical world, if you study even just like basic medical terminology, you'll be able to understand what we're dealing with exactly. So let's look at some medical terminology if we've never been exposed to that. So the prefix arth actually means joint, okay? So the prefix arth in medical terminology means joint, and the suffix itis means inflammation. So if you have something called tendinitis, right? Tendinitis, very common. It's just inflammation of the tendon. So what arthritis means is inflammation of the joint, right? So it seems pretty simple. Where it gets a little bit more complicated is what's causing that joint inflammation. So there are different what we call arthritides, and there's different things that can cause this type of joint inflammation, okay? There's really two categories. The first category is a lot less common than the second category. So less commonly, we deal with what we call inflammatory arthritis, okay? So inflammatory arthritis is a lot less common. Usually this is diagnosed by blood work. So if you went to the doctor and they ran a blood panel and they came back and they said, sorry, Susie, you've got arthritis, odds are you're dealing with an inflammatory arthritis. So some examples of inflammatory arthritis are like rheumatoid arthritis. We have ankylosing spondylitis. Hopefully you've never heard of that, because if you have, likely either you or somebody in your family suffers from it. Psoriatic arthritis, or even like a juvenile arthritis falls in this category of inflammatory arthritis. So this is a lot less common, and to give you an idea of how common it really is, I deal with an inflammatory arthritis in my office. Like once every couple months, we'll see a new case with an inflammatory arthritis, all right? So it's a blood-borne condition, not necessarily a biomechanical condition. The second type of arthritis is what we call a degenerative arthritis, okay? So, and let me come back here, backtrack a little bit. A lot more common in females here than it is in males, and usually it's anywhere between the ages of 20 and 40 years old, and a lot of times it runs in your family for this inflammatory arthritis. The reason I say that is we jump over to degenerative arthritis, and we'll see things like, stick with my colors here. So we'll see this in just about everybody, male and females. And like I said in our intro, just about everybody over the age of 40 has some degree of osteoarthritis in their body. Okay? So this is usually diagnosed by some sort of imaging. So we have X-ray, CT, MRI. So if you went for an MRI or an X-ray or a CAT scan and they came back and they said, sorry, Susie, you've got arthritis, odds are we're dealing with a degenerative arthritis, okay? So there is, in some circumstances, where you could diagnose these other conditions on an X-ray, but let's pretend that doesn't even exist, right? So odds are, if you were diagnosed with arthritis on an X-ray, a CAT scan, or an MRI, we're dealing in this category, okay? And like I said, just about everyone over the age of 40 has some degree of degenerative arthritis or osteoarthritis, okay? So another couple synonyms for for degenerative arthritis are osteoarthritis, okay? We have DJD, degenerative joint disease, DDD, degenerative disc disease. If you look on your X-ray and you see a big fancy word called spondylosis on your x-ray report. That's another example. Or even something as simple as like bone spurs. If you follow sports, you'll read like pitcher's got bone spur in their elbow. That's because what do you think they're doing with their elbow? They're just beating the crap out of it, right? They're on 100 pitches every 5 days, right? There's going to be some degenerative processes taking place. So these are all synonyms for this degenerative arthritis here. So we're going to focus mainly here today. We could do a different video on this inflammatory arthritis, but we're going to focus on degenerative because that's where a lot of our patients fall in that category. All right, so there's three stages of degenerative arthritis. So let's mark that up here. We're going degenerative. Let's give you some blue here too. Degenerative arthritis, okay? So the first stage is flattening of the curve. My chicken scratch. I swore I would never write like a doctor, but I guess I started. So naturally we should see this curve in our spine like this, right? When you look at it from the side and you see the discs lie right in here. Nice healthy discs, right? So we should see this curve in the spine, nice healthy curve of the spine, right? But what happens a lot of times is we'll actually get what we call flattening of that curve. So instead of having that reverse C-shaped curve that we see in the spine, we'll get this nice straight up and down. Well, actually, not very nice straight up and down. So this is a situation where it's stage 1 osteoarthritis, okay? Like I said, we're used to seeing osteoarthritis in people who are 40 and over. The scary part is because of cell phones and technology and whatnot, people are spending their day in this bent over posture. We're seeing flattening of the cervical curvature in people as young as 15 years old, okay? So kind of rewind yourself for a minute here. I talked about that graphic where osteoarthritis is most common in people over 40. If we're starting to see stage 1 in people who are 15 and younger because of technology, that number, that 40 graphic is going to come down to like 30 in a couple of years, right? The good news is stage 1 is the only reversible stage. So we'll kind of separate that here. Let's see what kind of color I want. So this is reversible, this stage. So if we find a 15-year-old with a flattened curvature, a lot of times we're able to kind of reverse that curvature, or at least reverse some of that curvature, right? Get you back towards normal, right? So we'll mark that too. This is normal. This is bad, all right? So stage 2 is decrease in joint space. So I'm using the spine as an analogy because I'm a chiropractor, right? So that's what I deal with every day. I mean, we do deal with hips and knees and shoulders as well with osteoarthritis. But, you know, the bread and butter, what we deal with is spine related. So I'm drawing a spine, but all of this process, it stays the same within, whether it be a spinal segment like L5-S1, C5, C6 are very common, but also, in your shoulder, your hip, your knee, this whole process stays the same, okay? All right, so stage 2 is decrease in joint space, and I'm going to go ahead and jump in and say stage 3 is what we call bone. That's supposed to be quotes there. I told you, doctor writing. Bone on bone, right? We hear patients say that all the time, okay? So I'm going to stop here for a second, okay? I'm going to use an analogy that we use in our office all the time. So we like to say degenerative arthritis is like a hard-boiled egg. Once you start boiling an egg, you can't unboil it, okay? So like I said, this is reversible. Anything to the left of this green line is reversible. Once we hit this green line, that's where we're dropping our egg in the water, okay? So our egg gets dropped in the water somewhere around here. So eventually this flattening of the curve is there for so long that the body decides, all right, we're going to start the next phase of this arthritis. So osteoarthritis is like a hard-boiled egg. You can't stop it from unboiling, but you could stop it from boiling further, okay? So let's get back on track here. So we still have that decrease or that flattening of the curvature in our segments. What we start to see is, notice how we got this nice healthy disc space here. All right, nice healthy disc space. Nice healthy disc space here. But when you come in here, right, this guy's super tiny, right? So we have what we call a decrease in disc space. This is why this happened, okay? I'm going to zoom in on that segment. So let's say we're going to zoom in on that segment right here, okay, with a decreased disc space. So there's something called cartilage. I don't know if you could see the yellow on the camera, but there's something called cartilage that covers this area, okay? That's in between the vertebrae itself and the disc. Okay, so then the disc comes in here, right? And then you have all disc in here, right? So this yellow thing there is the cartilage, okay? When your body's in a poor biomechanical situation for long periods of time, months, years on end, this cartilage begins to break down. So we start to see cracks in this cartilage, okay? So we start to see what we call micro cracks develop. When the micro cracks start to develop, the brain is super smart, right? It has all these sensory receptors sending signals back to it all day long. So the brain starts to recognize, oh crap, we're starting to develop those micro cracks. Cartilage is super important because we don't want to injure the bone. So let's start replacing that, sorry, I'm looking for my color here. Those micro cracks with bone. So let's actually lay down calcium in this area and start laying bone in here. So the problem is the body actually starts replacing that cartilage with bone. And what happens, it doesn't do so in a very uniform manner. It just kind of throws bone at it. And we start to develop these bone spurs off the segment. So a lot of times these things can develop, right? I'll draw it on our zoomed out version too. So we start to develop these bone spurs, right? Because we have this decreased joint space. This was orange too, just to kind of keep everything the same, not green. So this is all bad in there. So and also, where do you think this disc is going? This is a nice healthy disc. This is an injured disc, right? This is a nice healthy disc. Where do you think this disc is going if there's decrease in joint space? You think it's just disappearing? No, it's probably heading backwards, right? Into what we call a disc bulge or a disc herniation. You can learn more about that on the last video that we did. All right, so the last stage that we see is what we call bone on bone, and that's exactly what it sounds like, all right? So we have literally, the segments have kind of morphed into each other here, okay? So we'll start to see maybe like a little bit of room for a disc space, but not much. Or joint space, disc space, right? So that's no good. And where's my green? Right? Nice healthy disc space here, okay? So like I said, so first off, this situation is no good. Right. So when you're in stage 3, like I said, your egg is pretty much boiled to the point where, to use that analogy, your egg shell is starting to crack. Right. This point right here is usually the situation that ends in surgery. Okay. Not all the time, but if there is a situation that ends in surgery, it's usually that one. And don't forget, I almost forgot to draw our little bone spurs on this segment too. So usually the bone spurs are even worse. And it's usually just kind of riddled with bone spurs through here. And a lot of times in this stage too, we'll get like bone spurs shooting down into the disc space. It just kind of throws bone at the area. But over here we have this complete obliteration of that disc space, and we get this bone on bone presentation. Okay, so if your grandma has had a hip surgery, odds are her joint space narrowed down so much that it got to the point where there's actually bone rubbing against bone. There's no more cartilage left in that joint. Okay, so that's the bad news. If you don't do anything about it, it could progress to this point, okay? So what do I do for my patients who present with this condition? What do I do for my patients who present with osteoarthritis? Let's say we take an x-ray of their low back and we see that they're in the middle of stage 2, right? Is this a death sentence? Are they gonna live in pain for the rest of their life? Of course not, right? These conditions, this presentation has probably been occurring for years before it got to the point where it's developing symptoms. So what that tells me is that if this condition was here last week and they weren't feeling pain last week, we can get them to the point where, like they were last week, where it's not causing that acute pain, that pain that's going to impact your day-to-day life. Patients with arthritis, degenerative arthritis, usually present with like a morning pain that's relieved by motion. So they wake up in the morning, they're a little bit sore and achy, they get moving, the pain tends to dissipate, okay? How do we treat arthritis, okay? A lot of times it can be treated at home. So keep in mind, we're dealing with joints here, right? So keep in mind we're dealing with joints. Joints are designed to move, okay? Motion is the number one way we deal with arthritis. If anything in the body, if any joint in the body or anything in the body stops doing what it's designed to do, the body's going to begin to break it down, all right? So the number one we do is we restore what that joint's supposed to do. In this case, it's supposed to move. That's how we take that egg out of the water. That's how we stop it from boiling even further. So motion is the number one way, okay? So then we have what we call general motion, general mobility, and intersegmental mobility. Okay? General mobility are things like yoga, stretching, Pilates, right? And that's moving the whole segment, the whole as a whole here. So the whole spine as a whole. We're going to use the spine, continue to use the spine here. So if we have this segment, the spine is going to move as a whole back and forth, right? Where each one of these segments are performing their part in that general mobility. But when we get a decrease in disc space, what we see is instead of moving as their own individual movement blocks, these guys tend to kind of move as one, if that makes sense, right? So these guys kind of move as one segment, and then these guys are handling mobility here, okay? So now these guys are moving a little bit more. So the general mobility is good to make sure that the whole segment of that spine is moving properly. But when we get into intersegmental mobility, that's the job of your chiropractor. So when I come in here and I adjust, make sure L1 is moving completely independently of L2, and L2 is moving completely independently of L3, and L3 is moving completely independently of L4, and so on and so forth. That's the job of the chiropractor. So what we do with these patients is we give them mobility exercises to go home with. Usually a good morning stretching routine will help them kind of prime the pump and get moving when they get out of bed. And also to make sure we maintain what we call a wellness or a maintenance type of care chiropractically as well. So these patients usually pop in once every 2 to 3 weeks for what we call a maintenance adjustment, where they just lay down on the table. We make sure that each of these joints are moving the way that they're designed to move. And if they're not, we restore their level of mobility. Okay, this helps slow that degenerative process. Okay, and it helps the patient live their life and increase their chances of being able to perform their activities of daily living, whether that be bending over to pick up the laundry or going to play tennis or golf. Right, these are all activities of daily living that we want to maintain for our population, our patient population. Arthritis is a very, very common condition if you get diagnosed with it. Oh, last thing I'd like to say on arthritis, actually, before we close, is go back to that volcano analogy that we used in our previous video. So chronic conditions are usually like an active volcano. So a lot of times the volcano is lying dormant without any signs or symptoms, but all of a sudden that volcano can just erupt out of nowhere, right? So the further you get down on that path, that 1 through 3, so if you're in between stages in 2 or 3, the higher the likelihood of that volcano erupting. So if that volcano chooses not to, or if we can keep it in between 1 and 2, there's a lot less likelihood of that volcano erupting. So in English, if I don't have arthritis and I wake up with, say, a 3% chance of hurting my back, I'm making these numbers up. Somebody with arthritis might have like a 10% or a 15%, or maybe even a 35 or 50%, depending on where you are along that curve. All right, guys, I hope that makes sense. Thanks for watching. Stay tuned. Make sure you leave comments with any questions or any ideas for future videos. All right, guys, so I hope you enjoyed this, and we'll see you soon.